Thank you, Madam Deputy Speaker. I am grateful for the opportunity to lead this debate on a subject that, to the best of my knowledge, has never been discussed on the floor of this House before. I often speak of my 25 years as an NHS nurse because that experience has fundamentally shaped my understanding of the hidden struggles within our communities. It is from that perspective that I raise the urgent and often misunderstood issue of hoarding disorder. Many years ago, as a district nurse serving the Kingstanding community, the same community I am now proud to represent in Parliament, I entered homes where extreme clutter was not an anomaly, but a visible sign of a deep, unaddressed need. Today, we have a name for it. In 2018, hoarding disorder was formally recognised in Britain as a distinct mental health condition. It is defined by persistent difficulty in discarding or parting with possessions, regardless of value, leading to cluttered living spaces and significant distress or impairment in daily life. It is a widespread condition affecting between 2 to 5% of the population, which equates to approximately 1.2 to 3 million people in Britain. Let me be absolutely clear. Hoarding is not a lifestyle choice, nor is it a matter of laziness. It's a complex mental health condition deeply rooted in emotional distress and underlying trauma, often stemming from adverse childhood experiences. For hoarders, it can result in unsafe living conditions, social isolation, and a diminished ability to manage day-to-day responsibilities. If left untreated, it has a huge cost on families, the NHS, housing providers, and emergency services. On top of this, hoarding is a long-term condition with few effective treatment options, meaning behaviours are often left unresolved. My professional experience showed me the heartbreaking reality. Individuals are literally drowning in clutter, their mental health deteriorating, their relationships broken. Dealing with hoarding can be very time-consuming and expensive, with support falling disproportionately to ill-equipped local authorities and overstretched third sector organisations, such as Birmingham's own Clouds End CIC, led by the inspirational Eva Matuzo. Madam Deputy Speaker, the challenges can be broken down into 4 key areas. The first area is public health and safety. Hoarding doesn't just hurt individuals, but has knock-on effects on the entire community. The hazardous living conditions it creates, from severe fire risks and blocked escape routes to unsanitary and unsafe housing, pose a direct danger not only to the individual, but to their neighbours and the brave professionals and firefighters, social workers and others who are called in to intervene. The second, public awareness and education. We cannot combat what we don't understand. We urgently need to educate our communities and frontline professionals in social care, housing, health and emergency services to recognise hoarding as a mental health issue, to reduce stigma and promote more compassionate and effective intervention. Third, mental health and support gaps. Mental health services and treatments that address hoarding specifically remain scarce and underfunded. Many people affected feel reluctant to seek help because of stigma, lack of awareness, fear of eviction, or other legal consequences. Closing this support gap is not just optional, it is essential. And finally, is legal and housing implications. Housing providers can be faced with challenges, legal situations where tenants' hoarding behaviours lead to breaches of tenancy agreements or safety policies. Unfortunately, these cases are too often handled through eviction or legal action rather than providing support to address the root causes of the problem. We need policies that balance legal responsibility with compassionate mental health support. As a society, we have a responsibility to support those living with hoarding disorders. In Birmingham, the numbers needing support has risen exponentially since the COVID pandemic, and the story is the same across the country, as many members have highlighted. The seriousness and scale of this issue demands a coordinated national response led by government. We need a national strategy to bring consistency, reduce risk, and improve lives. The current legal framework is simply not fit for purpose. The Care Act of 2014 recognises that people who hoard may be considered vulnerable or entitled to advocacy. However, there are no national guidelines for agencies that encounter hoarding in their work. Without guidance, responses to hoarding will remain inconsistent and ineffective. In the absence of national guidelines, agencies are forced to rely on outdated legislation, such as the Public Health Act of 1936, which classifies these areas as filthy and verminous premises. Under these powers, a person can be forced to clear their property even if they own it. If they cannot afford clearance, it is undertaken on their behalf and charged to the property. This approach is deeply flawed. If hoarding is treated purely as a practical or environmental issue, rather than recognising that these are vulnerable human beings in need of help. By failing to recognise hoarding as a mental health condition, it risks traumatising individuals, worsening hoarding behaviours, and in the most extreme cases, contributing to suicidal thoughts. The human impact cannot be understated. Lack of proper support and compassion leads to further trauma, distress, and greater risk of accumulation. National guidelines would provide clarity on what the constituents' appropriate and effective practice, a consistent framework for agencies across the UK, a balance between addressing practical risks and meeting underlying mental health needs, and fourthly, a clear routes for advice, support and specialist referral. Madam Deputy Speaker, this brings me to my central ask of ministers. We need a coordinated national strategy for hoarding disorder. While the Care Act of 2014 provides a foundation by recognising vulnerability, the absence of specific national guidelines leads to a postcode lottery of care and inconsistent, often ineffective intervention. A national framework would provide clarity, consistency and compassion, balancing risk management with mental health support and establishing clear pathways for specialist help. I was proud that the Labour manifesto committed to recruiting 8,500 extra mental health staff and delivering a transformative 10-year plan for mental health. It is essential that these welcome initiatives explicitly include and address hoarding disorder. To end, I urge government to prioritise the development of national guidelines, equipping all frontline workers with the tools to identify and address hoarding compassionately and effectively, to ensure a truly integrated multi-agency approach, bringing together mental health services, social care, housing and emergency responders. 3, to invest in research and data collection to properly understand the scale, causes and economic impact of hoarding in the UK, ensuring our policies are evidence-based and resources are allocated wisely. In my nursing career, we were taught that prevention is always better than cure. This also holds true for hoarding. Early intervention is more humane and more cost-effective than crisis response. This is an issue that has remained in the shadows for too long. We have a duty to bring it into the light, to replace judgment with understanding, and to offer a hand up to the millions of our citizens living with this devastating condition. I look forward to hearing the Minister's response on how this government intends to lead that vital change. Thank you, Madam Deputy Speaker.